You just have to be retired, active, or have any sort of military identification saying that you were in the military or you are in the military. And that's the only requirements.
Now, I think it's absolutely an amazing service that you're offering. I know I just adopted a senior pit bull. Her name's Baby. She was supposed to be my emotional support animal. Hasn't worked. She has more anxiety than I do. But it is something that I think about quite often. She's senior, she's older, she already has a couple of benign growths on her, and that's going to continue happening. So that really is a stress on pet owners quite frequently of how are we going to pay for this sort of thing. Is that something that you've ever experienced, and is that why you were so invested in bringing this to other veterans?
Yes. So before I was a veterinarian, I was just a technician, and I've had to make really hard calls with my own pets simply because there was, do I pay my light bill or do I do this really expensive surgery? And sometimes the answer is I can't afford to do that. And that's just the unfortunate reality of veterinary medicine. We don't have insurance to cushion that. And that's not something we want to see happen. We certainly don't want these animals to suffer, and we don't want their humans to suffer either. And so it is something that I've had to have personally. Lots of friends and family that have had to make hard decisions when it came to finances, especially with emergencies. And so that's definitely something that hits home that we understand.
Now, something else that I want to touch on is you are a vaccine clinic, but you are publishing on all the flyers and everything a full range of some of the services that these veterans can get in the Vets for Vets program. Can you run through some of the things that people would be able to get at a lower cost or completely free from this event?
So we have some donated flea medications that we have some of those. We do have a very limited supply of heartworm medication. And so they will be getting free heartworm testing. Many of them will be getting free preventatives for at least a month, if not more, depending on how much we can get our hands on, and free exams. Now, with those exams, there may be some really easy fixes, like if there's an ear infection that we catch, we definitely have the funds in our account to take care of that. We can't do surgeries necessarily for free, but we do still give veteran discounts throughout the year at all times, and we run specials sometimes as well. But we're a full range hospital, so we go from boarding all the way to surgery and advanced dental stuff. We've got all the diagnostic equipment here, so if they bring us a sick pet, we can work them up that day.
Now, getting away from the event for just a second, is there any tips or tricks that you want people who may not be able to afford to get their pet into the vet at all times? Is there anything that pet owners can be doing at home to try and prevent certain common illnesses and common things that could go wrong with their furry little friend?
So two things come to mind. One is staying with a good quality dog food. And that doesn't mean the most expensive. It just means if you get a good quality dog food and you're feeding that food and you're not doing table scraps and you're not doing bones and you're not doing all those things, there is a whole slew of things that we can prevent. Bones like cow bones from your plate or chicken bones from your plate.
I made the face. They didn't see me
guilty?
On the viewer. I made the face of ooh if you didn't see it. I do. She's a senior dog, and in my opinion, she was in the pound for 4.5 years. So anything I make, just a little bit of it goes to her. Just a little bit. Is that okay?
So if it's really fatty, they can have some, most things that we see is GI issues everywhere. And a lot of times fat or dietary indiscretion, which is eating something that we're not used to eating, is the biggest culprit. So that's one of my biggest things is just if you keep their diet pretty predictable, they're less likely to have an issue. And preventative care. Preventative care is the cheapest way to keep your pet healthy. When you catch something early and you are preventing heartworms, diseases that are carried by fleas and ticks, skin infections that you can get from those things, you really are decreasing the chances of you needing to come to the vet outside of regular scheduled visits.
And I just want to repeat it just one more time for all of our viewers who are just now joining us. Is this, can you tell us a little bit more about the event? What day is it? When are people allowed to come? What is it for? And what ID do we have to have?
So it's November 10th. It's the Friday before Veterans Day. The requirements are that you were an active member of the military or a veteran, or that you'd served for any length of time and you have a military ID. It's for any species of animal. The most that are going to benefit are vaccine animals like cats and dogs, but we will see any breed that you bring in that day. And that's the only requirements. You can bring your whole family. You can bring 6 dogs if you have 6 dogs. There's no limit to how many that you can bring.
Alrighty. Once again, Dr. Pritchett with the Animal Health and Hospitals. Is there anything else you would like to add before I let you go?
That's it. If anyone can't come to the event, or they like the event, or they want to support the event, we do still take donations for the Vets Helping Vets, and that goes directly to veteran pets. We don't use it for anything else.
Can you tell me how people can donate, just really quick before I let you go? How are people able to help out with the Vets for Vet program?
The best way is just to call. If you give us a call, we can take the payment over the phone and we put it directly into a separate account. And it's Animal Health and Hospital, 903-753-7625.
Alrighty, once again, Dr. Pritchett, thank you so much. Vets for Vet, November 10th. We'll be right back after a short break.